President Trump today did some good old-fashioned arm twisting on Capitol Hill. The House votes Thursday on the Republican proposed health care overhaul. Changes were announced Monday after a report from the Congressional Budget Office estimated 24 million Americans could lose coverage. ABC 7's Dwayne Lindo joins us with more on how the American Care Act could impact you. Dwayne.
Well, Alan, the GOP continuing to make modifications, but according to some of these changes, may do more harm than good. Not only that, but the plan may also hurt the pockets of people over 60 as well.
It's been 7 years since President Obama signed the Affordable Care Act. Now, with much criticism, enter the GOP's American Healthcare Act, a plan that New College of Florida political professor Keith Fitzgerald says was put together in a rush.
And they voted to repeal it over 50 times, and they've had that entire time to be working through the details of an alternative. But when they came in here with majorities in both houses and the presidency, they essentially started from scratch.
The Republican health care plan would kill some of the current law, including tax penalties for people who don't buy insurance and Medicaid expansion. But according to Fitzgerald, those on the Affordable Care Act will lose big on this one, if it passes.
There will be literally millions of people who will lose their health insurance, and they don't have a plausible way of making sure that all of those people will be in better shape afterwards.
But the new plan did keep popular pieces of the current act intact. One includes allowing adult dependents to stay on their parents' health plans until age 26. The other has the Affordable Care Act's essential health benefits, which requires insurance plans to cover preventative care, maternity, and mental health coverage. And with the House Republican vote set for this week, the clock is ticking.
It's enormously complex, and so I would look at this as an opening bid, not as a final product.
Congressman Vern Buchanan admits there's more that needs to be done. Just recently, he held a town hall meeting right here at the Van Wezel to address some of those concerns.
We're in the very early stages of the legislative process. Next week,
the crowd clearly upset about the process that may affect millions, but Buchanan stressing he's making sure Florida is treated fairly when it comes to this plan.
The biggest thing was health care, and I was trying to explain to them that we're in a, out of 9 innings in a ball, baseball, we're in the 3rd inning. I am pushing for anybody 50 to 65 to make sure they get the same consideration or close to the same consideration as the ACA or Obamacare.
But according to Trump's new plan, premiums could be raised for older people. The bill allows insurers to charge more as people age and become more susceptible to health problems. But according to Fitzgerald, there are more questions than answers, which leads him to believe we may be under Obama's current plan for some time to come.
I think that there is a decent chance that this is not going to pass because they don't have a winning coalition yet. So we may not even get to the end zone this year.
The president obviously meeting with Republican leaders in Congress today, urging his critics to vote for this bill.
Dwayne, thank you.